Good morning, ladies and gentlemen. And it's my pleasure to welcome you to the Telemedicine Breakout Panel Conference, which we're going to have a great time this morning learning all the intricacies about telemedicine and the challenges that Florida faces in launching telemedicine. Why haven't we done it already? That's what you're asking. We should have done it a long time ago. And I tell you what, this is our year, so it's perfect. We're at the perfect place and the perfect timing to help launch our state into the next century and in technology. In fact, let me ask, where were you 8 years ago? Do you remember where you were 8 years ago? You may not remember where you were 8 years ago, but I can tell you what was in your pocket. In your pocket was not the iPhone, hadn't been launched yet. It was a BlackBerry. How about that? A BlackBerry. That was in your pocket. What website were you going to? You weren't going to Facebook as much as you're going there now. You were going to MySpace. How about that? 8 years ago, MySpace. Chris Cheney was there. That's what he did all day. MySpace. But other things. In fact, let me tell you something that's just kind of mind-boggling, and that is it. I don't know I think it's a tetrabyte. Whatever it is a quantity of information that has a bunch of zeros behind it. A tetrabyte, is that right, Tom Feeney? You may tell me, or Mike Hightower may tell me what a tetrabyte is. But whatever it is, let me tell you what it is. Bunch of zeros, but this is what a tetrabyte is. It took civilization, all mankind, from the beginning of recorded time to 2003. 2003, beginning of time, to amass 1 terabyte of information. That's all the information of everything ever learned, recorded, written down was compressed in that time, and that was 1 terabyte. Now, let me tell you what we're doing today. Mankind records 1 terabyte every 2 days. Every 2 days. I guess somebody's been clicking on their Facebook page an awful lot to record that information. But how fast are we going right now? We're going incredibly fast. So is it time to bring the technology, I guess, into healthcare? Now, I'm not going to say Florida is behind the times, but I went to my healthcare provider just a couple of weeks ago, and they suggested that I do some bloodletting, and they pulled out some leeches, and I felt much better after. I'm kidding. No, that's a joke. It's not that bad, but there is things that we're doing in Florida that's kind of behind the times. But this is our year. Literally, as we speak right now, in the legislative oven in Tallahassee, it's cooking right now, is our telemedicine bill that's I'm looking in the oven and it's starting to rise. There is still time to add some more ingredients. Maybe we need to mix in this or mix in that or mix in some, you name it, whatever it is. Hopefully we'll find some ingredients today. And that's what we're here for. We've assembled, I don't know how AIF does it sometimes. Tom Feeney and Tammy Perdue have put together an all-star panel just for me and just for you for the next 55 minutes. We'll get to learn from the very best. But to make things interesting, I'm going to say that we're going to change the rules just a little bit, and that is, I call it the telemedicine game. What we're going to do is hear from our all-star panels, and we're going to award them points for their responses. And then what's at stake, you're wondering? What's at stake? Well, for Florida and its 19.3 million residents, now number 3, how about that? Number 3 state in the nation. Give yourself somebody's clapping for that. We've populated better than everybody else. There you go. Phyllis is with me. She's clapping. So what's at stake? Well, for Florida, technology has the potential to deliver superb health care. We're going to get better faster. And how about this? As an added bonus, harnessing technology, we can do it in much cases, much more efficiently. I don't want to say cheaper, that's a dirty word in healthcare, but much more cost effectively and deliver so much better care. How about that? So that's good. That's what's at stake for Florida, but what's at stake today? Let me tell you what's at stake today. Once again, Tom Feeney has splurged on this panel, and what's at stake for our panelists today that they'll be vying for is the coveted AIF Moon Pie Award. That's what they'll be paying for. Thank you, Tom Feeney, for sponsoring our Moon Pie Award. Now, let me tell you what we're going to do. We are going to lead off with opening comments. We'll have a grueling questions from your host. We'll have the coveted lightning round. Everybody looks forward to the lightning round, where we'll have a 7-second response time from our panelists. They don't know the questions, and we'll get their gut reaction to some of the things facing society today. And then, how about this? A grueling audience participation round. Well, you'll get to actually ask our panelists what's on your mind, and then we'll give everybody the final word with the final question given to each of our panelists. Some of the how we award the points: if you agree with a co-panelist, you get 5 points. If you disagree with your co-panelist, you get 25 points. How about that? If you say smart things, you get 3 points. Agreeing with the host, 15. That's a good way to go. Make the audience laugh, you get 7. Make me laugh, 11 points. How about that? And if you make me say, well, that's a good idea, then you're going to get 13 points. So all kinds of points at stake. We got the little Debbies, all kind of good stuff. So let's meet our panelists on today's telemedicine game. First up is going to be, how about this? Here he goes. How about that? All the way from Ohio. All the way from Ohio, it's Dr. Michael Bess. Dr. Michael Bess is Director of Telehealth. How about that? And Optum. That's right, Michael. I was going to make him to say, what's your name and where you're from? But no, I'll do that for you, because that's why they're paying me top dollar, and they're not paying me anything, just the right to come here and enjoy telemedicine and the game today that we're playing. So Dr. Michael Bess is an MD, MHA. He is the National Medical Director of Telehealth. He is doing great things. We talked a little bit beforehand, and he's given me so much information to tell you about. Just let me tell you that he is, since joining United Health Group in 2013, Dr. Bess has served on multiple telehealth work groups from around the nation. So we'll get to see how Florida stacks up. Maybe that's a question somebody wants to ask him, how we compare with everything else. He's done a lot of stuff. He's also been in the hospital and the doctor's office and the emergency room, putting everybody together before he became one of our panelists. Would you please welcome to the stage for opening remarks, Dr. Michael Bess.
Hi, thank you. And I will agree with you, 2015 is the year for telehealth in Florida. So first of all,
15 points on the board already. Good job.
Thank you for having me today. I really appreciate coming down here, and Senator Bean and AIF for allowing us to tell you what we're doing in telehealth. I do have a couple slides. I don't know if they can load them up real quick for me, just to kind of show you what we're doing, what's going on nationally with telemedicine. Basically, we have a national offering. We're in 45 states plus DC. We are trying to continue to grow. There's a few states that are still a little slow to adapt. Florida is one of the states where we do offer telemedicine services for acute care, but we also do other things like remote patient monitoring, caring for people with disease. One interesting fact, and I don't know if this gets any points, but in the state of Colorado, you can buy marijuana, but you cannot get a prescription from a licensed provider in Colorado for something like flu or sinusitis, which is really interesting. We keep scratching our heads how that happened, but certainly those things do. So with that, I will go ahead and let one of my other group present.
We're going to see the slides in a few minutes.
Okay.
Or you want to see them now? Do you want to see them now? Do we have them? They're up. I think they're ready.
Oh,
Go,
okay.
rock
I'm
it.
sorry,
Rock
I don't
it,
see them
Dr.
on
Bess.
the front screen here.
You're on a roll.
This is a slide right here that kind of shows some of the solutions that we are doing. Basically, I'm going to talk today about the Now Clinic product, but some of the other things, thank you, there they are. And but some of the other things that we're really focusing on is chronic disease and living with illness. So remote patient monitoring, where you monitor patients at home to keep them out of the hospital. Some other things are tablet-based solutions to take care of hospice and palliative care patients. What is Now Clinic? We look at it as a technology to deliver care, to align the patient with the provider. And so there's a lot of tools that use. Most of the time we use video because that's a requirement now from some of the regulations that's come out over the last year. It was a big year in 2014 about what is appropriate for delivering care. 2015, we're seeing lots of legislation and sponsoring of bills to try to get these things paid for and make sure that they're offered safe to patients. This is a state where we're active. As I stated, Colorado is one of the states we continue to work on. We're on a telehealth work group. We just flipped Idaho over to green about a month ago, North Carolina, and I believe Alabama and Tennessee will be green within the next quarter. So what do you do? What kind of things are we treating? We're treating sinusitis, upper respiratory infection, those kind of things that are easy to treat, very cost effectively. Just to show you some numbers real quick, most of the conditions that we treat over in our clinic, we've done some data mining and evaluated. These cost $131 to treat on average. In traditional brick and mortar practice, we are getting close to getting that down to $50 a visit over in our clinic. So tremendous savings for employers, for patients, and for states to offer these services. Great satisfaction and uptake by patients. We're not taken away from the medical home. Only 23% of these patients said they would have went to their doctor's office. 1/3 of patients that try to get into their doctor's office, same-day appointment, cannot. So we think we're only taken away from 7% of the visits that are going to the medical home. And the prescription rate, a lot of the businesses that are represented today go, is this just a prescription service or my costs going to go up? We took a group and matched them to brick and mortar practice, and our prescribing rate over the Now Clinic was actually less for controlled match conditions. So 60% in brick and mortar, 60% over Now Clinic. So we're not driving up costs by adding prescription burden to the industry. And I just want to throw that out there real quick so you guys could get some stats on us, and we have some information back at our booth as well.
Very good. Dr. Bess, well done. On the board in a big way. You're all right now 67 points. That's a record, actually, for an opening panelist in a Bean setting, so well done. The slides were fantastic. Of course, you agree with the host, which is good, too. Ladies and gentlemen, our next panelist is Renee Finley. You heard from Craig Thomas this morning talk about the good things they're doing at Florida Blue and GuideWell. Renee Finley, and I've got a full one-page bio of countless things that she has done. But let me tell you what she is right now. She is GuideWell's Vice President of Enterprise Innovation. Quite simply, she is a thinker. She is a thinker, and she thinks for the company and keeps the company ahead of everybody else. How about that? So we're going to benefit from her expertise and her thinking of where we need to be. She's done numerous things. There's 2 paragraphs of awards that she's won. And let me get to the good stuff. She holds a Master's of MBA from Jacksonville University. So right there, she's going to get 37 points just for attending a dynamic, just a super school. Anybody that's gone that school has to be a very smart person. How about that? So she's completed executive programs, University of Vineyard, Darden School of Business, Northwest Universities. Additionally, she received certification from Wharton for strategic thinking, that's no surprise, and management for competitive analysis, and participates as a Wharton Fellow. Would you please welcome to the panelists, Miss Renee Finley.
Woo-hoo, thank you.
Renee, go get them, Renee.
So thanks so much for having me today. I serve as GuideWell's Vice President of Enterprise Innovation, and as Craig said earlier, we're really on this very important transformation from migrating to being Florida's largest health insurer to really being the nation's trusted source for health solutions. And our role in this journey is to really identify these new emerging capabilities and technologies and new ways of bringing them to market that can help move the industry towards transformation, better access to care, and hopefully lower and more efficient care delivery, lower cost and more efficient care delivery. And the ways that we do that, we undertake strategic partnerships, we undertake R&D efforts, and you saw the Innovation Center would invite anyone in the audience to meet with us afterwards to talk about how you might participate with us in some of that work. But I wanted to get back to what the Senator said at the beginning around what's happening in the marketplace today. And what we're seeing is really this movement from digital device to what I like to call the digital life. Consumers are embracing technology. It's embedded and integrated in everything that they do. They've downloaded over 100 billion apps in 2014, 100 billion. And we see them using these apps in every aspect of their life, whether that's banking, financial services, reservations, bookings. And so healthcare is the next frontier for that. So I think the time is right in 2015 for our state to be positioned to embrace telehealth and a broader scope of even remote healthcare. A PwC survey talked about nearly 1 in 2 respondents said that they would abandon traditional care venues in favor of more affordable and more convenient venues. So one of the things that we're doing in this space is really to think about how do we help enable and partner with our physicians through these connected devices to really provide this connectivity with the patients at a time that is convenient and in a setting that they prefer. And what we see here is this paradigm shift to the patient will see you now instead of the old doctor will see you now. We're seeing the patients really being the driving force, and that's a phrase coined by the brilliant Eric Topol. So we're offering these connectivity services through web or tablets to our physicians, and we're selling those to our ASO employers. But we really see there's this bigger level than just the tablet connectivity and the displacement of the physician care. And if we can get the slides up on the screen, what I'd like to do is take you through really a much broader view of the disruptors of remote healthcare. If you think about first of all, in the office itself, being able to have much broader capabilities for diagnostics. So one of the disruptors that we're bringing to market is the healthcare pod. It's an enclosed 9-foot station, so you have privacy, it self-cleans, but more importantly, it's embedded with diagnostic tools that will allow the physician to actually listen to your heart, listen to your lungs, see in close range a dermatological issue. So we think that these types of technologies are going to meaningfully transform that relationship with patient and provider so that you don't actually have to be face-to-face, but you're right there with them on the screen and they're still physically hearing that information. We do have one of these installed in our retail store in South Florida, so if you're in that area, stop by the fall store and you can actually engage in that. We've had over 350 visitors to that particular
Renee, what's fantastic, I don't mean to interrupt,
Yeah.
and your slide is up, by the way. It's just not
okay.
here, but you can see it up there, but it's just fantastic. I actually visited one of those kiosks. What's amazing is, and there it comes up right there. It comes up, the kiosk, and in fact, Florida Blue and other partners, Baptist South and Orlando Health and a whole bunch of other partners brought one of these kiosks where you actually go in, get examined in a private setting. The doctor's right there. But how great is, how many times have you gone to the doc and your spouse says, well, what did the doc say? And you say, they did a lot of stuff, but how great would it be to have your incomplete visit on a chip or on an email click where you can click and relive, well, honey, it's funny because I have this chip for you. You can relive my whole examination together along with all our vitals. So that was something that the Florida Blue, the kiosk team brought forward. Your
great.
Your slides are ready.
Wonderful. So also in this space of health disruptors, this concept of remote monitoring. So I think Craig talked earlier about eTech, which is the pill that you see, which is an investment that we've made through our Healthcare Accelerator Health Box. But other types of solutions here, the Scanadu Scout. Do we have any Star Trek fans? Do I get points for being a Star Trek fan? A geek? Great, there's some in the audience. So Doc, if you remember Doc, he had what? The tricorder. And Qualcomm has put forward a X Prize to reinvent the tricorder, a non-invasive diagnostic scanner. And so we're partnering with Scanadu to actually help to bring this product to market. So it's a non-invasive, captures about 12 different biometrics. So that's in that remote monitoring space, and I'll try to move quickly here. But also, there's a movement towards healthy home. We're working in a relationship with GE, Cisco, to bring technology solutions into the home setting for remote care management. So things like smart appliances that can measure hydration levels, provide nutrition supplements into your water, those kinds of things, actually embedded into the home. We're also working with a company called DASA Systems to develop an intelligent mirror. So this is a mirror that really captures in an ambient way, a non-intrusive way, your biometric data, provides that trending information over time, and then will provide trigger alerts when you're, for example, if you're in a chronic condition state, it'll highlight those points where you might be out of range. And if you are out of range, you can, through your mirror, have a conversation with a Florida Blue Care nurse right then and there so that you get your questions answered and do that first level of triage. And then finally, a healthy office. We talked a little bit about healthy office. Craig mentioned the worksite clinics. Remote pods can be a solution at your worksite to provide a much, much lower cost delivery of care. We're looking at technologies such as sleep pods. We know that the impact, there are 40 million Americans, and you might be one of them in the audience this morning, it's pretty early, suffering from sleep deprivation. And so being able to allow that 15-minute nap significantly increases productivity and workforce alertness. So major opportunity space there. Solutions like YoFi Wellness, another HealthBox company we've invested in, that provides real-time access to yoga, fitness, stress management, another issue that we know exists in the workforce. So those are just some examples of some of the technologies we have.
Renee Finley, well done. Off in a big way, which is great, actually topping Dr. Bess. And right now, you're at 68 points. Well done. Well done. Could have got some more if you went with Star Wars, but Star Trek still put you up there. And thinking and JU paid off big time for you. Ladies and gentlemen, our third panelist is Dr. Andrew Wagner. He's the Chief Medical Officer for Stat Doctors. Prior to medical school, he has done a whole bunch of early stage technology. In fact, launched an early stage technology company on the West Coast. He's done so many other things for the community as well as interactive, trying to better everybody's health through technology. The man is the right place at the right time. He received his undergraduate training at Bates College in Maine and then went to get a medical degree from The Ohio State University of Medicine. And I tell you what, Stat Doctors is on the cutting edge of doing great things too in telemedicine. Please welcome to the podium, or to the panel, Dr. Andrew Wagner.
Thank you, Senator Bean. First, I'll just start off by agreeing with you, Senator Bean, and totally disagreeing with my other two panelists. And the audience laughed, so I don't even know how many points I got, but I'm clearly crushing it today. Telemedicine, and from Renee's presentation, is so expansive. And what we find when we start talking to clients about telemedicine, and just anybody about telemedicine, your worldview expands so much that you have a hard time trying to figure out which way to go. At StatDocs, we are laser focused on acute unscheduled care. I'm an emergency physician by training. Our company was founded by an emergency doc, and frankly, it was founded under the premise that we didn't understand why patients kept coming to the emergency department for things that we could treat by the family doctor, by an urgent care, and when you talk to the patient, it's very reasonable. Family doctor's not open all the time. It's not convenient. We live in a society that is an instant gratification. I want everything now. So 5 years ago, Dr. Alan Roga, the founder of STAT, started STAT Doctors, and really it's about 24/7 access to a board-certified ER doc. We can beam an ER doc into your living room via computer webcam, any mobile device that's out there, and really start trying to foster or rekindle that historic doctor-patient relationship, which I think we frankly have lost track of. The doctor used to know that you had a golden retriever, little Joey just graduated from middle school, et cetera, et cetera. Now you're not even sure which doctor's going to show up. So we're trying to take technology and trying to recreate that historical doctor-patient relationship. And so we can talk about sort of what states we are in, patients love it, et cetera, but I'd like to kind of show you what we're talking about. I don't know how many people have actually experienced a telemedicine visit, but when patients get done, they say, why didn't you bring this to my house years and years ago? This is what online banking was 20 years ago when people said, I'm not doing that. Well, I think that the video we're about to show will show you how far we've come, and then hopefully in the discussion we'll talk about sort of where StatDocs thinks we're going. So could you play that video? So this is how you access our app. Here's a patient at home. and she has a headache today. And so rather than going to the emergency department or going to the urgent care, she logs in. It's HIPAA secure, password protected. You can see her company, what her copay will be, and as easy as hitting the green button. So we got to make sure you get a doc license in the state where you're currently located. We have integrated geolocating as well. She tells us a little bit about herself in terms of what her current chief complaint is. And she moves forward. So these are the forms you fill out when you go to the doctor's office, right? But this is a lot simpler. You can add medications, add your medical history. If she goes in for a second visit, all of that's still there, but she can modify it. We ask you to confirm the information. And then she's selecting a pharmacy. So you can put in your zip, if you actually know the pharmacy's phone number, city, state, it's pretty easy. But let's say you're traveling and you don't know where the pharmacy is. You can check out where you are and check out where all the pharmacies are, pick one, and move forward. So each visit in the Stat Doctors is a $50 visit, but the employer can cover any portion or all of that portion. We find that utilization is much better when the employee copay is lower. Right now, the doctor is being paged. Our physicians can interact with the system both mobile. We think we have the only or the first mobile app for our physicians. And literally, it's that easy. Doctor talking to patient. Each consult is 10 to 15 minutes. You know, in medical school, I learned 95% of diagnosis coming from the patient telling you what's going on, not all of these fancy tests that we've come to love. And so this type of interaction, 10 or 15 minutes, is great for the doc, great for the patient. Once the doctor fills out their discharge instructions, the patient has an online record of what happened. So peer-reviewed discharge instructions, where the prescription went, personal instructions from the physician. So I don't know how many people in the audience have had a virtual visit, but it's real easy, real simple, and you know, our patient satisfaction is 98%. It's no wonder. You compare that going to the emergency department, which is a 4-hour wait time, you're around a bunch of sick people, it's crazy in the emergency department, and you just condense that into a 10-minute process from the comfort of your home. Thank you.
Well done. We have our first round winner right there. That is a good idea. That is crazy good idea. That is just fantastic. I have been to a doctor recently, and everything you've described is so accurate of waiting. I'm not a good waiter. How about that? Not a good waiter, especially when you're sick. Nobody's a good waiter when you're sick, but that I can do. So that's a good idea. So you get the that's a good idea bonus. You made the audience laugh several times. You disagree with your panelists, and you're right now, and you have a fantastic video and a fantastic product. If you could just come up with a fancy tagline like "Getting better just got easier," and you already did, so we'll give you that as well. So right now, Dr. Wagner in the lead with 74 points. Now, ladies and gentlemen, let's go to host questions. And let me ask you something. That right there is absolutely fantastic. Should we be worried in the state of Florida, though? Because let me tell you where we are. And you may ask me, or somebody may ask me, well, Bean, and I get asked all the time. By the way, ladies and gentlemen, she just walked in. She's sitting in the back. She's probably texting somebody else, not listening to me, so we'll surprise her with an induction. But Representative Mia Jones is in the back right there. There she is right there. Representative Mia Jones is going to be leading a panel later on, but she's also actively involved in telehealth. We're four of our partners in the House. I know Representative Williamson probably couldn't take any more of Senator Bean and probably hit the road already. He was here just a few minutes ago, and so say hi to him if you get a chance. Here's where we are. There he is right there. So there's all kinds of folks all over. Is that Dr. Representative Pigman right there? So very good. Dr. Pigman, we look forward. Both our representatives are going to be leading breakout sessions, so check your panel, check your program for up-to-minute information of what they're going to be doing. It's going to be something good. But let me tell you where we are in telemedicine for our bill. See, last year our bill was 26 pages, and we got really detailed in definitions of how we were going to do it, how we were going to proceed, and we really put we actually put in the bill the guidelines of what we thought a visit should be paid, how we were going to go about doing the platforms and all. This year, we're down to 3 pages, and we really let the free market define what they want to do. We give a regulatory framework to make sure that people involved are licensed medical professionals from the state of Florida, where we know that they're doing a great job and have the necessary requirements and continuing education and insurance and all kinds of good things like that. There was a fear that if we don't go too far, or the balance, that people are going to be using FaceTime or text messaging to claim to see a doctor like that, which is, that right there is great. But how do we ensure that we're getting quality from something that is right in our face? Dr. Wagner, you go first. What do you think? How do we assure that that's going to happen with so little, or are we wrong, or should we have more regulation? What are your thoughts?
Less regulation is probably better, but
Hey, 17 points right there. Less regulation. That's from the Tom Feeney School of Government. Well done. Okay, so, but tell me, how do we, for those that say we can't assure quality, what do you say to them?
So, you know, I think that the biggest point is you guys need to get to a point of clarity for everybody. And so there are clear rules, but the rules don't stop you from being innovative in the future. You know, I'll give you a great example. So we've approached state medical boards that have a telemedicine license. Great, right? Well, you find out that that telemedicine license is for teleradiology and telepathology. So they were being very innovative probably 10 years ago when that was the hot topic. But now they don't know how to handle sort of the new world. So I think you need to make sure that when you create rules that they're flexible enough to, you know, create the quality programs, which in essence is all about medical care, right? How do you coordinate docs? How do you have algorithms and best practices? How do you have great quality programs? These are table stakes in delivering medical care. The technology is just a way to connect people and do it responsibly. But, you know, you really need to make sure that you create legislation that's clear, but also flexible.
Very good. Dr. Bess,
Renee, anybody?
Yeah, so I agree with you in terms of we certainly don't want more, yes, another point there. We certainly don't want more rules or barriers to innovation. We want to let the free market drive that. Certainly, I think there's an opportunity as the markets continue to evolve to integrate telehealth just like other care delivery into value-based, right? So that we're really getting to the outcomes and we can identify that the quality has been delivered in the outcomes that are achieved.
So you think it's okay? You think it's okay if we just have the bare minimum and let the free market go get them? Is that what you're advocating? Right. Yes, she does. Dr. Bess.
Well, I want to agree with both my panelists for 30 points and you about not a lot of legislation. I will say 2014 was a banner year for developing regulatory responsibility for telemedicine. Several things came out during the year. The Federation of State Medical Boards came out with a model policy for telehealth applications in April 2014 that really gives some standards of how do you establish a physician-patient relationship, how should you be able to prescribe, and we're seeing many states adopt those policies, and actually some model legislation, for example, in Idaho is just coming out to use the FSMB as a backbone after the medical board accepted that. Other things that you see is AMAs become involved and they have some policies. Really when you see telehealth policy, you see 3 buckets: licensure, as he talked about, permissibility, what can you do, and then also reimbursement. And those are the 3 big issues that we see over and over. And I think one of the things that the legislature needs to be careful of is not putting too many restrictions on the ability to deliver the services, keeping it open for the future of what happens. And there's one organization that really is at the forefront of this, American Telemedicine Association. They've come out with an accreditation program for online care services similar to what Now Clinic is and what you're offering. We're pursuing that, and it goes through and makes sure that you're following all state and federal board rules and regulations, that you credential your providers appropriately. So there's a lot of guardrails that have come out over the last year. And so I think these services are safe and effective. Those are the standards that you have to live by. So I think that the people here can feel relatively safe that that these are services that are going to be offered in the right way if the right organizations are doing them and meet those standards.
Very good. You mentioned Idaho, and this is for anybody, and you can jump back into what states are doing it well. And if you said, Bean, if there's one place you need to look at, it's these states. Anybody rocking it right now?
I think New Mexico is really rocking it. They have been really aggressive in how they approach telemedicine. For example, one of the things that I would encourage you to do is for your Medicaid population, we already saw that's a growing population. There's a lot of restrictions in many states, including the state of Florida, of originating sites and where the patient is physically located. New Mexico said, hey, you can do it anywhere, including your home, just as we saw on the video. And so really that population, it almost leads to inequities in care for that population. So that would be something you may want to address in your legislative bill.
We'll look at anybody else. Any states rocking it right now? Dr. Wagner.
You know, New Mexico is great. Vermont, though I'm not sure how many people actually live in Vermont.
We think Vermont would make a great county in our state. That's how tiny they are. But keep going.
But, you know, I think that if you want to think on a big picture where the states fall into, there's really three buckets. And one bucket is, don't you dare do this type of medicine in my state. Those are becoming very few, but there are a few of them. Then there are states that are more progressive that have clearly changed at the medical board and state pharmacy board level of what you can do. And then there's everybody in between, and that's the majority. And quite frankly, Florida took a step to, you know, allowing it and being clear on it when it clearly said in the middle of last year, you need to do this by video. I think that's supported by FSMB's policy. It, from just a gut physician perspective, makes sense to me. But you know, the states that are the problems are the states that are in that regulatory gray zone that are not either jumping to don't do this or clearly do this. And we've seen that. You mentioned Idaho. Idaho, we saw a physician literally lose her license there, and her career is probably ruined, quite frankly, because she was doing something that she thought was okay, and she got made an example. So, you know, Florida needs to be commended for being progressive here, and let's get the rules on paper. Let's get everybody to agree so that you've got the right medicine being practiced in the right way, virtually.
Is there any state that we shouldn't look at, or somebody that's just is not any state come to mind that we should definitely not emulate? I don't know if anybody here is from, I won't say the state, but is there any?
You know, I think that there are a few states that just have not come far enough along.
I got you. Are folks, I know y'all travel and you do all these conferences, is anybody making fun of Florida for being so far behind? We need to know that right now so we can make a list.
Absolutely not,
Very
Senator.
good. Okay. So
I'll agree with them. They're not making fun of Florida.
very,
All right.
very good. What's at stake? This is truly a softball, ready for you guys to hit it out. What's at stake for Florida? What's at stake if we don't or if we do pass it, or if we don't pass it? What's at stake? Renee.
Yeah, so, you know, I think there's, when you look at the long-term view of what's happening and the movement towards this Internet of Everything and, you know, I think 50 billion connected devices by 2020, what's at stake is that we're not going to be providing the highest level of quality care because we won't have the opportunity to have these integrated systems in place. And that's where the real value will come, is when we have the connectivity and the collaboration of the stakeholders through the digital connectivity. That allows us to provide that predictive view of health versus a past view of health.
And I would further say, you know, some of the applications that we're developing at Optum are for chronic management of patients. And so these are the patients that cost the most for the employers, for the state, and being able to manage that patient population with illness, keep them out of hospital, keep them healthy, will ultimately help save healthcare dollars in the long run.
Very good. Dr. Wagner.
I think that this is one of those solutions that you have to support because it's going to touch every facet of healthcare, and consumers want it. The idea of building these large centralized hospitals Yeah, I firmly believe in 30 years we're going to say, why did we build all of those rooms? We don't need them anymore. Literally, you're going to go to the hospital because it's an ICU, period. Other than that, beyond intensive care, it's all going to be at your home. So if Florida doesn't start getting on board and doesn't start thinking about how do you deliver health care at home, and key to delivering health care at home is you got to have the doctor in the driver's seat. We've seen that nurse hotlines don't work because you just shift the liability to the referring organization. So you need a physician in the driver's seat to be able to make the medical decisions, to be able to coordinate care, and I think telemedicine is how you do it.
Very good, very good. All right, I'm going to have my person turn this mic on. I'm going in the audience. It's a tight match. Your questions could decide our winner. If anybody has a question, let me know, and hopefully this is on, and it is. Let's go rock it. All right, who's got a first question? Now, the first question is always tough because you set the stage, and I've got our first person right over here. Is that Rose Knapp? Of course it is, Rose Knapp, CEO of Florida Health Choices, Florida's innovative, dynamic healthcare exchange. Rose, welcome. We're glad to have you here.
Thank you, Senator Bean. I get confused about what telemedicine really is, and so this is my question. Is it a unique service, like acupuncture requiring a unique provider license, or is it an addition to the delivery system, like a specialty clinic? Is it a product to be regulated like insurance, or is it a benefit to be paid and covered under insurance? And I don't know the answer.
All of the above. No, I'm just kidding. What we try to view telemedicine is as a tool to deliver care to patients, whether it's a provider to the patient or a service to try to keep them healthy, but it's a tool, it's not the care. You have licensed providers that, for example, are on the back end. They're trained, they understand how to treat disease in patients, and they're using technology to deliver that care, just like you go to the bank to get or do online banking. So it's not a revolutionary thing, it's just leveraging technology, hopefully to gain efficiencies, decrease costs, make it easier to convenience to see providers and manage patients. And it's a broad, as we heard earlier, very broad what kind of applications there are.
Dr. Widener, you got a thought. What should we include in our definition of telemedicine?
Yeah, I mean, to answer your question directly, it's yes, 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 and yes. It's all of those things, but really we look at it as a technology-enabled service. But, you know, I think key to this, and you say, is it a specialty? I firmly believe in 5 or 10 years there will be a telemedicine specialty. Our model is a little different because, one, we only utilize board-certified ER docs, but we also have an exclusive network of docs, so we don't hire the random family doctor or the random ER doctor and then have this loose network. We have a consolidated group of docs, and if anybody has managed docs in the past, you know it's like herding cats, right? It's challenging. And you talk about having to get an ER doc to retrain their brain, not to refer everybody to the ER, and how do you disposition people virtually? It's going to be a specialty on its own. So it's all of those things. But I think that there's, in the end, what it is, it's medical care just delivered in a bit of a different way.
And I'd just like to disagree with my colleague here, the panelist. I don't think this needs to be limited, especially for the applications that we're using for Now Clinic, to just board-certified emergency physicians. We have physician assistants, nurse practitioners providing these services in local care delivery organizations. They're hitting the ball out of the park, and many times they do just as good or better than the physicians in delivering these services. These are services that you would get at the convenient care clinics in the fast track of the emergency department or at a doctor's office. So limiting to board-certified emergency physicians, I think, is a little it costs too much. You're not delivering the services with the right provider.
And I would only let you know that on Florida's health insurance marketplace, most of those who are buying comprehensive policies from us are also buying telemedicine products when they buy major medical to supplement their coverage.
Very good. Thank you, Rose Knapp. And Sally is right next and coming to Paul Sanford next. Sally, tell us the good news.
So I'm Sally West with Walgreens, so you can probably imagine where this question is going. So I was thinking about the video that you showed of the app that had one doctor speaking to the patient. And I was wondering whether down the road, is there an opportunity for, rather than just one physician to be on video or phone with that patient, is there an opportunity in a chronic care type of situation to bring in the patient's pharmacist? And I'm thinking in particular of HIV, when perhaps the patient is starting a new round of therapy, to bring in the pharmacist to talk about side effects, to work with the patient's physician on managing side effects, as well as increasing adherence to those medications.
So you're really talking about multi-party video, having the
Yes.
pharmacist, the physician, the patient. We have the technology. That exists today. It literally is a little bit of IT engineering, and my CTO will kill me for saying this, but we can do that. We need a willing partner. I think Walgreens would be a great one.
Yeah, I would add to that. If you look at a technology like eTech, it's more than just the encounter where care needs to be delivered. So the real-time, day-to-day activities and what's happening with the patient as they're going through their daily life, when they're actually taking medications, are they compliant with that medication? So to have the pharmacist and other care providers and quite frankly, even other sort of health motivators that are in my personal ecosystem to be connected with that information is so powerful to ultimately the health outcome that'll be achieved.
And I'd just like to say, I think that's a great question. A lot of the things that we've seen driving new services that come out via telemedicine, unfortunately, is reimbursement, because somehow you have to pay these providers to give their time, or you got to prove cost savings and have the plan understand that and integrate it into their delivery model. So I think that's a great idea. We're trying to do that with certain populations like palliative care and hospice and those kind of things, but it should be available to everyone. Certainly it would save dollars because then you would have less mistakes and issues and things like that. But a lot of it drives by reimbursement. So hopefully as legislatures and as Medicare comes out with more policies for telemedicine, and they are progressing in the right direction, hopefully we'll have those services available.
Thank you.
Very nice, Sally. And on that reimbursement, we're trying to let the free market decide what a telemedicine. I remember we were debating if you see the doctor live versus not seeing them live, what's the difference? But you know what? That's a question for the free market to decide. Paul Sanford, what do you got for us?
Thank you. I know we're looking at all of the things you've told us about today, the stat docs, Optum, you're doing business in all of the states, I assume in Florida as well, and the things that Renee has brought up that are going on. The fear that we have with legislation, like your thought is, do we need legislation, or do we need to let the marketplace work so we don't stifle innovation and cost savings?
Well, that's a great question. I think that certainly if you develop policies similar to the Federation of State Medical Boards, I think that's great. I think, as Senator Bean said, with reimbursement, you really need to be careful, because if you start charging for the same as face-to-face visits, you really lose some of the power to leverage these to decrease costs. And ultimately, who pays for that? It's you, the patient, or you, the employer, or you, the state. And so if you can try to leverage these technologies to decrease costs and deliver these services in a more cost-efficient manner and more conveniently to patients, everybody wins.
And, I'm told that, Paul Sanford, that we need legislation because, the largest health provider is the state of Florida. We've got 3.7 million people in our Medicaid program, and we don't recognize a visit if you see somebody telemedically. Putting it in statute will. But again, we've had a successful rollout of statewide managed care. So we've got these companies that are already doing it. Why not just recognize, let them treat their patients the best they can? A follow-up, Paul Sanford, go right ahead.
One question on that. If we put in the statute that Medicaid must pay for these services, you have then almost eliminated the ability to negotiate the price because you have to have it. Is telemedicine really? It's not a new service. It's a way to provide services that you've been providing, and it would seem that if you code it right, you'll get paid.
Panelists, anybody want to tackle that? It's a trick question.
You know, I think the more that we can continue to move the market towards value-based outcomes and care, that's where we need to push the payment issue. The market dynamics, current contracting arrangements, the standardization, you know, of the technologies will provide those frameworks, and the market will evolve. But I think, you know, as we continue to think about pushing and integrating telehealth towards these value-based outcomes, just like a patient-centered medical home model, is probably the right answer.
And I will say we integrated telemedicine into a local care delivery model that's an accountable care organization. And when you go to them and show what they can leverage, it's an easy sell. They look at it and they say, how can we offer these services? Can we do more? And so when you have that level of at-risk, really the provider groups want to grab onto this as fast as possible.
Panelists, I'm sitting here with Jack McRae. He represents AARP. Let's see what Jack has to say.
Good morning.
Good morning.
Florida has the fastest growing elder population in the country, and many elders, particularly the oldest components, are very uncomfortable using the IT technology. What's been the experience of other states in terms of, one, providing access for the elder population with teletechnology, medical technology, and what can Florida do to get seniors more comfortable and give them the access to it?
So I haven't worked a lot out of state, but just to comment on sort of what's emerging in the marketplace, a lot of the home health solutions are moving towards sensor-based, more ambient capturing of information, so that there's not a requirement for the patient or the consumer or the elder in this case to actually enter a lot of information into some system or tablet, but it's actually being captured ambiently from either their body or from devices or sensors within their home. So we're able to understand a sort of a comprehensive view about what's happening with that patient. So the technology will help almost inform and provide that information where the elder wouldn't have to take the time to do that.
To follow up on that, I think that, you know, our population that we treat are primarily the employed. So when you get into retirement age, you know, we don't have much experience. But I think that what you're really going to need to do is have a system that brings the technology to them. So do the medics have a portable telemedicine kiosk that you can facilitate beaming the doctor in there to avoid an unnecessary transport? I think that it's very challenging. You know, when you feel poorly, you just want care. And if the technology is difficult or challenging or it's not in your wheelhouse, you're not going to do it. So the retirement age folks, we're going to need to get creative about, you know, how do you bring sort of a blend of brick and mortar plus technology to them and facilitate the doc virtually coming in.
And I'd just like to comment, Optum knows that population very well. Our remote patient monitoring devices that get shipped to the patient, nobody's there on site. Only 1 in 20 needs to call and have follow-up to try to help set it up, and then there's somebody that can walk the person through. So 19 out of 20 people, it's so simple that that population is who we're targeting, and you know, it's simple to use for them, and they can understand it well.
Well done, panelists. I'm sitting here with Anna from Empower, and she's got a question regarding telehealth.
Thank you. I am the CEO of Empower, and we're a mental health organization, and oftentimes with mental health, we get forgotten in the telehealth world. We've been doing telehealth in Florida for the last 3 years, and Senator Bean, in March, the Medicaid Community Mental Health Handbook did start allowing telehealth. So we have been piloting that. We've gotten it negotiated with 4 of our 5 MMA insurance panels right now. The problem is there are no private insurance folks that are approving, to my knowledge, to have telehealth, psychiatry involved. What do you think it's going to take in the legislation to do that? In fact, one of the other issues that I want to bring up, Medicaid, although it does allow telehealth and telepsychiatry, it requires a hub and spoke, which means we can't provide the services in the client's home, which is a huge issue for us because one of the biggest problems with that population is transportation. So how do you see, and maybe some of this is for you as well, how do you see the legislation impacting that?
Thanks, Anna. I appreciate you bringing up the behavioral health side because it is so important to the overall health outcome. We're just beginning to work in this space. Actually, one of the other investments we've made is in a company called Tau Connect. They're currently working on pilots in 14 of our universities across the state. To be able to provide remote telehealth behavioral management support for stress and anxiety among students. And so it's a way that we're starting to learn and understand how the technology can help enable that. It's not the one and only venue. As you said, there's a wraparound service that comes with that. That's so important for the clinician to be involved, but it does allow for ongoing sort of real-time capturing of what's happening with that patient. And so far, the results have been very, very positive in terms of the success rate with the patients.
And I think behavioral health is probably one of the best use cases for delivering telemedicine. Optum Behavioral does reimburse for services, but they do have the originating site requirements. I am hopeful, I've been at some meetings recently, that they may allow reimbursement into the home. When that'll happen, I don't want to say because I may get in a lot of trouble if I say that they're going to do that.
You know, the hub and spoke model that you talked about is exactly a result of over-engineering legislation. The economics don't work of that model. And it doesn't make sense in today's day and age. So I think it's a great example of probably well-intentioned rules that have actually hurt the industry. So when Florida is thinking about how to create it, that's why I think less regulation is better.
Very good. Here's our final audience participation question. It's an issue that the legislature got bogged down in last year, and it concerns crossing state lines. Phyllis from Baptist Health.
Thank you, Senator Bean. So what have other states done, or what are some models or solutions to handle going across state lines? Because Florida certainly does not want to limit expertise, medical expertise coming into our state for diagnoses and specialty cancers, for example. You might need to go where there's a clinical trial and get that consult. But yet physicians are really reticent in our state to allow those cross the state lines. And I certainly don't want to go on my iPad and dial up a doctor in India. That's not what I want to do. But how are other states controlling that? Because Florida exports a lot of medical, and we import a lot of medical through medical tourism.
Toss up panelists. Crossing state lines. Dr. Michael.
Yeah, I figured it was coming to me. That I saw it coming. Basically, a lot of our model is that we have doctors that are licensed in many states to provide care, so that at any one time you have a lot of states lit up at the same time, because we don't know where patients are going to come, but they have to be licensed in that state. So, for example, if you access our services, it'll be a Florida licensed physician. In fact, I live in Ohio. I'm Florida licensed. I actually did my training in Daytona Beach. I'm not providing care to Florida people right now, but I have in the past. So, you know, they go through the licensure process. But then I believe that they should be able to provide care. If you have somebody at the Cleveland Clinic that's a specialist and you need to consult with them, if they have a Florida license, it seems reasonable that a patient should be able to have a counsel, even with their oncologist, to try to get their opinion as well.
See, I would take it a step further, and I know that Florida is struggling with this concept right now. You know, my medical license in Colorado is no different than the one in Ohio, which is no different than the one in Florida. You know, I went to an accredited medical school. I went to a great residency. I passed my boards. I took more exams than I care to think about. But every time I apply for a state license, I've got to submit a volume of paperwork. And, you know, The reason is that medical boards want jurisdiction over the medical care that's going on in their state, and I get it. And absolutely, their mission is to protect the livelihoods of their citizens. But there has to be a way where we can allow the medical boards to have that jurisdiction, but not make it so bureaucratic to gain multiple licenses or get permission to practice across state lines. I think the FSMB is working on something now. I think that that'll be the next challenge to handle. But you know, I think what Florida's doing now in just trying to clarify the practice model is a great first step.
Very good. Ladies and gentlemen, our time is nearly up. We will now proceed to what we call the lightning round. Each of our panelists will get 7 seconds to answer the question. It really will be a chance to see their gut reaction. There's 10 questions. You'll be rated on your response. If you do feel like passing, you get 1 pass question if it's just too tough, so no sweat. So if you're ready, and what we'll do is we'll start with Dr. Mike, and then we'll go that way, and then we'll rotate questions. So you won't always be the first, and we'll just rotate, so it'll be then Renee and then Dr. Andrew. So if you're ready for the lightning round.
Let's go.
All right, here we go. All right, Dr. Mike, you're on the button. Remember, 7 seconds. Here we go. Is it the Affordable Care Act or Obamacare? Dr. Mike.
Obamacare.
Renee.
Affordable care.
Obamacare.
All right. LeBron or Michael Jordan? Renee.
LeBron.
I grew up in Cleveland, LeBron.
I got to say LeBron.
Ooh, looking for Michael Jordan was the correct answer. So, right there. All right. Valentine's Day is coming up. Most romantic movie of all time. Dr. Andrew.
Pass.
Okay. All right. Dr. Mike.
Star Wars.
Good one. It is indeed a love story. Renee.
An affair to remember.
Very good. Correct answer, Officer and a Gentleman. All right. Top 2, back to Dr. Mike. Top 2 GOP nominees. Who's going to be in there? You get 2 choices. Top 2 GOP nominees. Who's going to be there in the end?
Ooh, I'm going to pass on that.
Yeah, I'm going to pass.
Jeb.
Very good. Okay, good. The King decision is a Supreme Court decision that they're going to decide on the intricacies of Obamacare or the Affordable Care Act, which really gets to the heart of exchanges and how subsidies are given on a scale from 1 to 10. 10 being absolutely devastating, 1 having no effect of all. What is the rating of the impending King decision that it could have on Obamacare? Renee, scale of 1 to 10.
4.
3.
4.
Really? I thought it would be 8. In fact, that's the correct, I'm looking at it, it's 8.5 is the correct answer. Okay, here we go. Dr. Andrew, was Tom Brady telling the truth? Dr. Andrew?
No.
No. Mike?
Of course he was. Tom Brady does no wrong.
Okay, very good. And Renee?
No.
He was not telling the truth. My God says he was telling the truth. So, all right, Hillary or anybody else? Renee? Hillary or anybody else? Ouch.
Hillary. I'll go with Hillary.
Hillary.
Anybody else?
Very good. Bonus points for Dr. Mike. All right. If you could only go to one website for your news, what are you going to go see? Dr. Andrew, what's that one site you go to?
Wall Street Journal.
Wall Street Journal.
Agree. Wall Street.
Yahoo.
Yahoo. Correct answer, Drudge Report. Looking for Drudge. All right. Best Bruno Mars song. Renee.
Wow, I'm not good at music. I have to pass.
Pass. Okay, very good.
I have no clue.
I can't think of the name right now, but this is good.
Okay, very good. Audience, anybody? Best Bruno Mars song? Anybody? Uptown Funk is the correct answer. All right, and our last lightning round question, and we're going to go back to Dr. Mike to start us off. In one word, how big is telehealth? One word.
Infinity.
Very good, Renee.
Undescribable.
Dr. Andrew.
Gargantuan.
Very good. All right, y'all were all close. The correct answer was epic. Epic.
That's
That's right there. Okay, ladies and gentlemen, that concludes our lightning round. Congratulations. Now we're in a tight match, and a very tight match. And in fact, it's so close, I don't know what to do. So we're going to have to let you write down a number. If you'll have your pads. And this is it. I know Tammy Purdue. In fact, I'm going to talk about Tammy. Hopefully she's not listening so I can talk about her behind her back and brag on the great job she's doing. But let's do this. The Grammys were last night. Here is your tiebreaker question. How many Grammys did Michael Jackson receive in his lifetime? Write down a number, everybody write down, you can play at home if you want to, write down a number at home. This is our final question, and yes, we're about to wrap it up and award our coveted Tom Feeney Best Panelist Banana Marshmallow Pie Award. So write down a number. All right, so very good, are you ready? Okay, let's start with Dr. Andrew. You came out strong, you had the dynamic video of showing how easy what the future of healthcare is gonna be. What number did you write down?
Now you're testing me on pop culture. This is a problem.
That's exactly right.
10.
10, okay, very good. The correct answer was, anybody know? 13, so you're just 3 off. Very good standing right now. So we'll move to Renee. She did great, came from a great school, and also the pod last week gave you an insight. But what number did you write down, Renee?
8.
8, okay, so just a few little off right there, no worries. And this guy, I don't know how he gets any work done, still celebrating the national championship from his alma mater of the Ohio State. What number did you write down, Dr. Mike?
I put 4.
4, so Andrew, that's fantastic. So congratulations. So I'm telling the final score, I don't know how this worked out because I'm still adding up, but here we go. Your final award winner in most points, would you please welcome your coveted Tom Feeney Moon Pie champion is Renee Finley. How about that? That's fantastic. So Renee, that's fantastic. Renee, we're going to get a picture of Tom Feeney presenting this to you in just a few minutes. But gentlemen, oh yeah, let's hug right now. Okay. Hooray, well done. Let's get a picture right here. All right, great. Congratulations out there. But gentlemen, don't worry, we've got parting gifts. In fact, we've got it's red velvet moon pie cakes for our parting gifts right there. Well done. You did a great job, my friend. Well done. Hooray. All right, good job. Well done, my friend. Great job. We'll get pictures. I know we actually ran out of time. Here she comes. So let me brag on you because there's an unwritten rule in the state of Florida that we can't start a healthcare meeting. And there's some yucky stuff. Y'all know that it takes a long time sometimes to sit through a lot of details and everything, but we can't start the meeting in healthcare unless Tammy Purdue is president, because when Tammy is present, everybody that belongs to AIF is there in that room. I can't tell you the times that she gets up and speaks on your behalf. Much of the changes we're making this year is because of Tammy's involvement, but Tammy, Tom, Feeney, Brewster, and so many of the AIF team, it's just a great organization. I want you to feel confident that they're working hard for you. So with that, ladies and gentlemen, I've already run over time and just want to ask our panelists, if you'll stick around, we'll get a picture for everybody. And I tell you what, let's make it a great week, a great day, and look forward to seeing you guys in Tallahassee. Thank you very much, our panelists. A round of applause for them. Well done. Very good, Tammy.
Thanks, you guys. And thank you, Senator Bean, for your kind words and your leadership and your great insight and entertainment today. While these guys are kind of, if you guys maybe walk off that onto that direction.
We're gonna get a picture.
Oh, I'm sorry, picture wrong way. Okay.
Come on, hey, Renee, we'll get a quick photo here.
Yeah.
No, you
In
gotta
fact,
bring your moon
Tammy,
shots.
bring your awards. This is
Yes.
epic that Tom Feeney
While
is gonna
they're
present.
photographing, why don't we have the next panelist assemble over here? And if everyone can bear with us just a couple minutes, we'll get transitioned just a moment. So if the folks on the controlling cost panel with Dr. Pigman can get right here, we'll move along.
Tammy, let's get Tammy in one for one. Tammy, you get in here too. In fact, you're gonna get right here. All right, everybody's gotta squeeze together a little bit. How we look? Awesome. All right, super. Super, guys. Thanks.
Join me in thanking our panel one more time. Thanks.
Oh, it's good. No, it's fantastic. Thanks for, it was fun.